7 Enemy prostate nutrients. Prostate symptoms. Do you often feel the need to go to the toilet at night? Do you have ongoing drips after urinating? Do you feel pain in your groin, hips, lower back or legs while urinating? Do you have difficulty starting and ending your urination? If you are experiencing these and similar problems, you may have prostate disease. It is one of the problems that men often encounter after the age of 40. You can support my channel by liking, commenting and subscribing before going to our video. What is prostatin function? The prostate is a gland. It is an organ located just below the urinary bladder, through which the urinary canal passes, and also the tubes that bring the sperm from the testicles are opened. The main task of the prostate gland is to secrete part of the fluid that makes up the semen. It is about the size of a walnut in its ungrown state. What is prostatit? Prostatitis is inflammation of the prostate gland. Due to the inflammation that develops in this disease, the prostate gland swells and is painful. Although prostatitis is sometimes caused by a bacterial infection, often a microbial condition may not be found, and the cause of prostatitis is not fully understood. In contrast to prostate enlargement or prostate cancer, which are usually the problems of older men, prostatitis can occur in adult men of all ages. Selenium mineral is extremely important for prostate health. Most fruits and vegetables and foods such as seafood, garlic and eggs are some foods rich in selenium. According to studies, men who adopt a diet rich in selenium-rich foods have a 50% reduction in prostate cancer risk. Selenium is important for men because as age progresses, the amount of selenium in the body decreases and prostate health is also at risk. So what are the 7 natural nutrients you should consume to reduce the effects of this ailment and prevent its occurrence? Broccoli. Broccoli is a vegetable that contains a wide variety of active ingredients. This active substance, which has protective and preventive power against prostate cancer, is sulforaphane. This substance targets cancer cells and causes their death. Broccoli contains a natural antibiotic called quercetin. Broccoli is an excellent helper against prostatitis complaints. Vegetables such as broccoli, cauliflower, Brussels sprouts and cabbage contain a substance known as sulforaphane. Avocado. Avocados are a source of vitamins C, E, K, and B6, B2, B3, B5, as well as folate, magnesium and potassium. It also contains lutein, beta-carotene and omega-3 fatty acids. Avocado contains high levels of healthy, beneficial oils that can help a person. Avocado, which contains 5 active substances that inhibit the 5-alpha reductase enzyme, helps to reduce the problems associated with benign prostate enlargement thanks to this feature. Those with prostate problems can consume avocado 3 or 4 times a week. Tomatoes. Tomatoes also contain high levels of vitamin C, folate and vitamin K. 100 grams of tomato is 18 calories. Again, tomato contains 0.9 protein, 3.9 carbohydrates, 2.6 sugars, 1.2 grams of fiber and 0.2 grams of fat per 100 grams. Consuming tomatoes can meet 1/3 of the daily need for vitamin C. Tomatoes are very rich in lycopene, an antioxidant substance that benefits prostate cells. In order for the lycopene to be released, it is recommended to cook the tomato or consume it in the form of tomato sauce. Salmon. The omega-3 fatty acids found in salmon have an important role in preventing the development of prostate cancer and slowing the growth and progression of existing prostate cancer. It meets most of the daily protein needs. There are about 22 grams of protein in 85 grams of salmon. Salmon is a rich source of vitamins A, C, D, B6, B12, D and E. It contains minerals such as magnesium, iodine, phosphorus, selenium, potassium and iron. The oil rate is low. Pomegranate. Pomegranate, which is rich in phytonutrients called antioxidants, and elagitanin, has beneficial effects on prostate health. Studies show that pomegranate extracts slow down the proliferation of prostate cancer cells and accelerate the programmed cell death called apoptosis. Pomegranate contains potassium, calcium and iron minerals, as well as vitamins A, C, K, B vitamins and folic acid. High polyphenol content should also be mentioned. Polyphenols are secondary plant pigments. Pomegranate is among the fruits with the highest antioxidant content. Pumpkin seeds. Pumpkin seeds protect the prostate gland against prostate enlargement thanks to its active ingredients. At the same time, pumpkin seeds have a great effect on eliminating infections in the bladder without spreading. Pumpkin seeds also improve sperm quality in men. Pumpkin seeds vitamin B, vitamin E, potassium, magnesium, selenium, manganese, phosphorus, and zinc care. Onion and garlic. Studies have shown that men who consume onions and garlic have a 50% lower risk of prostate cancer. You can minimize the risk of developing prostate disease by adding onions and garlic to your meals and salads. Ready-to-use garlic preparations have been used for a long time in the treatment of prostate cancer and benign prostate enlargement. Positive effects on prostate cancer, anti-inflammatory, antioxidant and general cancer inhibitory effects come to the fore. In addition to all these, the foods you need to reduce in order to stay away from this ailment are as follows. Red meat. Studies have shown that prostate enlargement is less common in people who do not consume red meat, and that daily meat consumption increases the risk of prostate enlargement 3 times. Dairy. As with red meat, regular consumption of milk also increases the risk of prostate enlargement. Reducing the consumption of butter, cheese and milk can help reduce prostate complaints. Caffeine. Caffeine is a diuretic. It increases the need to urinate. Foods and beverages rich in caffeine are coffee, tea, soda and chocolate. Reducing your caffeine consumption will reduce your risk of developing prostate disease. Alcohol. Alcohol increases urine production. Therefore, alcohol intake causes an increase in prostate complaints. Salt. The sodium in salt causes an increase in complaints in prostate patients. If you want to be informed about useful information on our Natural Health channel, you can support by liking, subscribing and pressing the bell button. In this way, you can watch our new videos with the notifications that will come to your message box. Stay healthy, see you again.